According to urologists, most men are never told the full truth about prostate enlargement, and that is why this condition keeps quietly worsening year after year without warning signs that feel urgent enough to act on. Medical experts say that by the time a man realizes his prostate has grown large enough to affect his sleep, his bladder, or his confidence, the process has already been happening silently for a decade or more. And what surprises many men is that medication is not always the first or only answer. According to clinical observations, nutrition plays a powerful role in how prostate tissue behaves, grows, and inflames over time. In fact, urologists consistently point to one overlooked nutrient that many men are deficient in, and that deficiency alone may be accelerating prostate enlargement faster than aging itself. If you are over 40, over 50, or even over 60, and you've noticed slower urine flow, more nighttime bathroom trips, pressure in the lower abdomen, or just a feeling that something isn't the same anymore, medical experts say this conversation matters more than you think. According to urologists, prostate enlargement does not begin as a disease. It begins as a biological response. The prostate is highly sensitive to inflammation, hormone shifts, insulin resistance, and nutrient availability. When the body lacks specific nutrients that regulate cell growth and inflammation, prostate tissue becomes more reactive. Over time, cells multiply more than they should, swelling increases, and pressure builds around the urethra. Medical experts explain that this is why symptoms often appear gradually and feel easy to ignore at first. A slightly weaker stream, waking once at night instead of never, needing a few extra seconds to fully empty the bladder. None of these feel alarming in isolation, but together they signal a prostate that is responding poorly to internal stress. According to urologists, the nutrient that stands out most in men with enlarged prostates is zinc. Medical experts say zinc is not just another mineral. It is one of the most concentrated nutrients in healthy prostate tissue. In fact, the prostate contains more zinc than almost any other organ in the male body. This is not accidental. Zinc regulates cell division, controls inflammation, supports immune response, and plays a direct role in testosterone metabolism. When zinc levels fall, prostate cells lose their ability to regulate growth properly. According to urologists, this creates an environment where enlargement becomes more likely, especially as men age. Medical experts say that zinc deficiency is extremely common in men over 40, not because they are unhealthy, but because zinc absorption declines with age. Digestive efficiency drops, stomach acid weakens, and dietary patterns shift away from zinc-rich foods. At the same time, stress, alcohol consumption, processed foods, and certain medications further reduce zinc levels in the body. According to urologists, many men are shocked to learn that even with a normal diet, they may not be absorbing enough zinc to meet the prostate's demands. According to medical experts, zinc plays a protective role by slowing abnormal prostate cell growth. Laboratory studies have shown that zinc helps regulate apoptosis, the process by which damaged or unnecessary cells are safely removed. When zinc is low, this regulatory mechanism weakens. As a result, prostate cells accumulate rather than renew properly. Over time, this accumulation contributes to enlargement. Urologists emphasize that this is not about shrinking the prostate overnight, but about restoring balance so growth pressure eases naturally. According to urologists, zinc also reduces inflammatory signaling inside prostate tissue. Chronic low-grade inflammation is one of the strongest drivers of prostate enlargement. Medical experts explain that inflammation causes swelling, fluid retention, and increased blood flow to the area, all of which add volume to the prostate. Zinc helps calm this inflammatory response by stabilizing immune activity and reducing oxidative stress. This is why men with adequate zinc levels often report less pelvic discomfort, improved urinary flow, and fewer nighttime disruptions. Medical experts say that zinc also supports hormonal balance, particularly the conversion of testosterone into dihydrotestosterone, or DHT. DHT is a powerful hormone linked to prostate growth. According to urologists, excessive DHT activity within prostate tissue accelerates enlargement. Zinc helps regulate the enzyme responsible for this conversion, potentially reducing excessive DHT signaling. This does not eliminate hormones or suppress masculinity. Instead, it supports healthier hormone regulation, which benefits both prostate size and overall vitality. According to urologists, the biggest mistake men make is assuming that prostate enlargement is inevitable and irreversible. Medical experts stress that while aging cannot be stopped, the biological environment inside the prostate can be improved. Zinc is not a drug. It does not force changes. It supplies the prostate with what it needs to regulate itself more effectively. When combined with improved hydration, reduced inflammatory foods, and better blood sugar control, zinc becomes part of a larger strategy that supports prostate comfort and function. Medical experts say that zinc works best when sourced consistently, not foods naturally rich in zinc include pumpkin seeds, oysters, grass-fed beef, lentils, chickpeas, and certain nuts. According to urologists, pumpkin seeds are especially beneficial because they combine zinc with plant compounds that further support prostate health. However, many men struggle to consume adequate zinc through food alone, particularly as appetite and digestion change with age. According to urologists, supplementation can be helpful, but only when done correctly. Excessive zinc intake can interfere with copper absorption and cause imbalance. Medical experts recommend moderate, consistent intake rather than high-dose experimentation. This is why men should always consider quality, dosage, and overall dietary context. Zinc is not a magic bullet, but when used responsibly, it supports the prostate's natural ability to regulate size and inflammation. Medical experts also emphasize that zinc does not work in isolation. It performs best alongside adequate vitamin D, magnesium, and omega-3 fatty acids. According to urologists, these nutrients work together to reduce systemic inflammation and support cellular repair. Men who focus on a single nutrient while ignoring overall lifestyle may see limited results, but men who support their bodies holistically often notice gradual but meaningful improvement. According to urologists, improvements in prostate comfort often appear subtly at first. Better urine flow, less urgency, fewer nighttime trips, reduced pressure. Medical experts say these changes are signs that inflammation is decreasing and tissue behavior is stabilizing. This process takes time, but it is far safer and more sustainable than relying solely on medication without addressing underlying deficiencies. Medical experts stress that shame and fear prevent many men from addressing prostate health early. According to urologists, prostate enlargement is not a personal failure. It is a biological response influenced by nutrition, hormones, and inflammation. When men understand this, they are more willing to take proactive steps rather than waiting until symptoms become disruptive. According to urologists, one of the most important shifts men can make is paying attention before pain appears. Prostate health is not just about avoiding surgery or medication. It is about preserving sleep quality, confidence, independence, and daily comfort. Zinc supports these outcomes by strengthening the prostate's resilience rather than forcing suppression. Medical experts say that men who educate themselves early tend to experience fewer complications later. Knowledge reduces fear, action restores control, and small, consistent changes compound over time. According to urologists, the men who do best are not those who chase quick fixes, but those who quietly support their bodies every day. As this video comes to a close, medical experts want men to hear this clearly. Prostate enlargement does not mean decline. It does not mean weakness, and it does not mean your best years are behind you. According to urologists, the body is remarkably responsive when given the right support. Zinc is not a miracle, but it is a foundation, and when foundations are restored, everything built on them becomes stronger. If this information helped you understand your body better, stay curious, stay informed, and remember that proactive care today protects your freedom tomorrow. According to urologists, the men who take responsibility for their health early are the ones who continue living fully, confidently, and independently well into later life. According to urologists, one of the most misunderstood parts of prostate health is timing. Medical experts say men often wait for discomfort to become unbearable before taking action, but by then the prostate has already adapted to years of internal stress. What most men don't realize is that prostate tissue responds slowly but predictably. When the internal environment improves, inflammation does not disappear overnight, but it does retreat. According to urologists, this is why consistency matters more than intensity. Small daily support repeated over months does more for prostate size and function than aggressive short-term interventions. Medical experts explain that the prostate is not isolated from the rest of the body. Blood sugar spikes, poor sleep, dehydration, and chronic stress all influence how prostate tissue behaves. According to urologists, zinc becomes even more effective when these surrounding factors are addressed. Men who reduce late-night sugar intake, hydrate earlier in the day, and prioritize sleep often report faster improvement in urinary symptoms. This is not coincidence. The prostate relies on stable blood flow and hormonal rhythm, both of which are disrupted by modern lifestyle habits. According to medical experts, nighttime urination is one of the earliest signs that the prostate is under strain. When inflammation increases, the prostate presses against the bladder neck, triggering false urgency signals. Zinc helps calm this response by reducing inflammatory mediators, but urologists emphasize that fluid timing also matters. Drinking large amounts of water late in the evening forces an already sensitive system to work harder. Men who shift hydration earlier often notice fewer interruptions at night, which further improves hormone balance and tissue recovery. According to urologists, another overlooked factor is chronic low-level infection or irritation. While not always clinically obvious, repeated irritation can keep the prostate in a defensive state. Zinc supports immune regulation, helping the prostate maintain balance rather than overreact. Medical experts say this is one reason zinc has been studied for decades in relation to prostate health. It does not suppress the immune system. It helps it respond appropriately. Medical experts also note that emotional stress plays a larger role than most men expect. Long-term stress elevates cortisol, which interferes with testosterone regulation and increases inflammation. According to urologists, men under constant stress often experience faster progression of prostate symptoms. Zinc supports the nervous system and helps buffer stress responses, indirectly protecting prostate tissue from stress-induced inflammation. This connection is rarely discussed, yet clinically observed again and again. According to urologists, men often ask how long it takes to notice changes. Medical experts explain that early signs of improvement usually appear within weeks as reduced urgency or improved stream consistency. Structural changes take longer, often months. This timeline discourages men who expect quick results, but those who stay consistent often experience meaningful relief over time. The prostate does not need force, it needs stability. Medical experts stress that prostate health is not about perfection, it is about direction. Supporting zinc intake, reducing inflammatory foods, moving the body daily, and managing stress shifts the prostate away from constant defense mode. According to urologists, this shift alone can slow or even partially reverse enlargement progression in many men. According to medical experts, fear-based thinking causes men to either ignore symptoms or obsess over them. Neither approach helps. Understanding the biology restores confidence. Zinc is not a promise of cure, but it is a tool that aligns with how the prostate naturally functions. When men understand this, they stop feeling helpless and start feeling involved in their own health. According to urologists, the goal is not just symptom relief, but preservation of quality of life. Sleeping through the night, feeling confident leaving the house without anxiety, trusting your body again. These outcomes matter just as much as lab numbers. Medical experts say that men who prioritize daily prostate support often maintain independence far longer than those who wait for intervention. As this topic comes to a close, medical experts want one message to be clear. Prostate enlargement is common, but suffering is optional. According to urologists, the body responds to care at any age. Zinc is one of the most important nutrients the prostate depends on, yet one of the most frequently overlooked. When restored thoughtfully and consistently, it supports balance, not suppression. If you are watching this and wondering whether it is too late, medical experts say it is not. If you are wondering whether small changes matter, urologists say they matter more than you think. And if you are waiting for symptoms to force action, remember this. According to urologists, the strongest results come when men act before urgency becomes pain. Your prostate does not need fear, it needs support. And when you give the body what it has been missing, it often responds quietly, steadily, and powerfully over time.